What's up, guys? Welcome back to another episode of the Medicopolis podcast, where two teenagers discuss medical dilemmas and police them to reach an ultimatum on whether the situation is ethical or not. Thank you so much for taking the time out of your day to listen, and we hope you enjoy our episode on the ethics of AI usage in healthcare. So, machine learning, which is a subset of AI, has been the most popular approach in recent times in current healthcare applications, since it basically allows computers or computational systems to learn from data, patient data that's already out there. So, this data could include, like for example, even a patient's red blood cell count, or it could also be their age. But the point is that data pertains to the patient. And this machine learning is essentially analyzing that data, and it's improving the performance of the healthcare worker by giving them the tools to directly make a stronger impact on their patient. And deep learning, which is a subset of machine learning, uses neural networks with multiple layers to identify patterns in large data sets. So again, it's kind of like a detection system within data that basically analyzes disparities or like differences in the data that can be used and that can be honed in on for the advantage of the physician or the healthcare provider during their care. But the problem or the ethical challenges that have been faced is that machine learning algorithms are close to black boxes, which basically means that they're very difficult to interpret, especially by a human. And with this difficult interpretation comes problems that the physician or the other healthcare personnel is not able to give the proper treatment because there's problems with the AI. And that's essentially what the ethical problems boil down to in recent times.
So, another one of the ethical challenges with AI usage in healthcare comes with safety and transparency problems between not only the doctor and the research, but also the patient and the diagnosis or whatever the AI is being used for. For example, IBM Watson for oncology uses AI algorithms to assess information for patients' medical records, and they help physicians explore cancer treatment options for their patients. However, it came under some criticism recently because it gave unsafe and incorrect recommendations for cancer treatments. And it seemed to be in the training of Watson for oncology. So instead of using real patient data, it was only using like trained synthetic cancer cases. Which means these cases and the solutions to those cases weren't actually from real patients, but instead were devised by doctors at the MSK Cancer Center, or the Memorial Sloan Kettering Cancer Center. And these errors only occurred as a part of the system testing, and no treatment recommendation was given to a real patient, but is still something that can happen as a result of a wrong data set, which is actually a common problem with AI in general, whether it's, medical usage or even just, cars or somehow our fridges. AIs and everything lately. So there's a lot of ethical issues that come with it, but in the future, and especially as these problems get addressed, we can see how they'll get fixed over time.
Yeah, and I think that the biggest problem here was not that it had like necessarily a wrong it had wrong data or incorrect data because it was trained with a few synthetic cancer cases. The problem was that it wasn't given a large quantity like a large enough set of data or cancer cases or like different like scenarios basically to kind of work with, and that limited the ability to give correct treatment or it gave unsafe and incorrect recommendations for cancer treatment. So the real ethical issue is that it's basically relying on insufficient previous data to drive the algorithms, and that clearly proved to be a problem here. Although you noted that it didn't actually have a real impact for other systems, that's certainly something to worry about. Where if there's not enough data going into the AI and it gives incorrect treatment methods, if it was used in the lives of patients and it actually gave them incorrect recommendations, that could seriously be a problem. So that's definitely something big to note with a current disparity or issue in AI right now and its usage in healthcare.
Yeah,
Another,
and
go
sorry,
ahead.
you sort of brought up this. I'm just gonna cut you off there. You sort of brought up how there was insufficient amount of data. That also sort of ties into our other, or I guess another one of the ethical problems that come with AI usage, which is algorithmic fairness and biases. So basically, as some of you might have heard of, several real world examples have demonstrated that algorithms can exhibit biases that can result in injustice with regards to ethnic origins or skin color or gender, even. Some of you may have heard of the Google case back in, I believe, 2016, where AI misjudged a person because of their skin tone. And even in the healthcare world, sorry, these problems can pertain to not only a patient but also whatever data set they're looking at. If they see a wide variety, or I guess you can even think about this in the opposite way. If there's a very short range of skin tones or genders for a certain data set, then you can see problems with how the AI presents itself to a person that um, doesn't fall under another or a type of data that the AI hasn't seen yet, if that makes sense. So it's important to realize that as AI datasets grow, they also need to be balanced in a sense. They need to include all sorts and all types of people and all of their problems in order to get the most uh, fair and accurate judgment.
Yeah, and I think going off of that, like the real like algorithms don't have actual real like biases like rooted in them like humans
Sure,
do
yeah.
with like education. The thing is that they're just oblivious or ignorant to I guess for example like phenotype like plays a role in how like um I guess how treatments are being delivered, especially with what is it called with dermatology, for example. Like a certain type of skin or a certain skin tone has a different amount of melanin than another skin tone. So like I guess giving these AI systems the education of like that there are disparities or there's differences with the people should be able to drive better like results in the future where they understand that okay, not every human is exactly the same and has the same system. So that's basically the point that we're coming behind with biases and fairness in algorithms and that problem. And another problem with this is that AI systems, at least so far, have not necessarily been trained on how to like provide physicians and other healthcare workers with their decision making process. So basically like they don't explain why they went from X to Y and Y to Z. And with like incorrect data sets as well as insufficient data sets that we were talking about earlier, where algorithms can actually not produce the correct results or the correct treatment methods for the healthcare personnel that it's actually assisting, then if even if a healthcare worker were to go back and like they're not able to go back and look through why the AI bot goes from decision X to decision Y and Y to Z and actually track the problem. So they have no idea that there's actually a problem going on with the AI system, and that's causing issues, like actual issues within healthcare because they're delivering incorrect treatment methods or delivering incorrect treatment based on not even knowing that there's a mistake with the decision making process of the AI bot. And also with like black boxes that we were talking about where healthcare workers aren't necessarily able to understand what the AI system is like like the results that it's producing and them just going forward and making kind of a decision based on their own interpretation, which may be wrong. It definitely does have a linkage to algorithmic unfairness and bias because it's not really like the algorithm is driving this unfairness and bias, which could definitely disproportionately affect people of like low income minorities.
So just to give a couple of examples of AI usage in healthcare, uh, the FDA actually approves AI-based medical devices, and in total, they've already cleared and like approved 40 AI-based medical devices. For example, in January 2017, Arteries received clearance from the US FDA that medical imaging platform as a first ML application could be used in clinical practices. It was initially cleared for cardiac magnetic resonance image analysis, but arteries has meanwhile also received clearance for other substantially equivalent devices. So cardiac magnetic resonance image analysis would be used for things like oncology. So that would be running AI on different types of imaging to see how the heart looks under these images to see if they could possibly find any problems like arterial diseases.
So Ashwin, so
IDX. Oh yeah,
do you
sorry.
think there could potentially be like problems with like black boxes or any other ethical problems that arise from usage of this of arteries?
So while Arteries hasn't reported anything so far, I think the biggest issue that they could face is definitely black boxing, because as opposed to something like marginalization or bias in the data set, right? The thing with black boxing is it can be used if AI is used in a complex setting like arterial imaging, right? And they're trying to diagnose a problem. If it's especially when there's a not lack of research, but there's also just like how do I explain this? The situations can get complicated in terms of how to diagnose a certain disease, if you get what I'm saying.
Okay.
So I think if the AI makes a jump that the physician can't understand, then that can derive into some problems that have to be dealt with. But as far as biases go, I don't think we'd be seeing those things because it's not necessarily it's a less of a physical data set, if you get what I'm saying.
Yeah, I think
Yeah, yeah.
yeah. I agree with that. I agree with that. So
IDX DR is the first FDA authorized AI diagnostic system that provides an autonomous screening decision without the need for a human being to interpret the image or results, additionally, or to help provide further insight. So this was released in April 2018. Where the FDA permitted marketing of this AI-based device, and it was able to detect more than a mild level of the eye condition diabetic retinopathy in adult patients, which were aged 22 and older. And they were also able to help with the diagnosis of diabetes as well in relation to that diabetic retinopathy. So basically, what the physician would do is that they would upload the image of the patient's retinas to a cloud server, and then the IDX-DR software would then provide the physician with a recommendation either to rescreen or to refer to like a specialist when more than a mild diabetic retinopathy problem was detected. So I think as far as the ethics go, Saj, and I just have some foresight to your question. I feel like again, one of the biggest problems that we'd run into are probably black boxing, because especially I think that's definitely the common problem that we're going to run into in the future is just black boxing in general. Because as far as the data sets go, it's harder to make those specifically targeted towards one group as it is just making them very complex for the physician to understand the jumps that the AI makes, right?
yeah, I'm glad that you were able to predict my question there. I guess a follow up question to that is like with black boxing, right? The healthcare, like the medical professional is not really fully understanding the IDXDR, or they're not basically able to interpret the what is it called, the recommendation correctly. So I guess how do you think that the physician should inform their what is it called, their patient, that they may not be able to, you know, interpret their data or their like results of their eye imaging correctly, or like what extent should they like inform their patient, I guess, if this black boxing issue were to arise?
I guess this is my answer sort of dependent on the speed at which the AI gets back to the physician, right? Because if the AI is able to detect a problem or diagnose a patient within I don't know some arbitrary maybe a week or something, right? That issue it might possibly be just like a very supporting basis. Like the AI is just providing a supported solution that the physician then looks into themselves, if you get what I'm saying. Like if the physician doesn't understand the jump that the AI made, it shouldn't be or a physician shouldn't be giving that result to a patient. Because without a human checking on these problems, I feel like sometimes the AI might have things that slip through the cracks, or the physician might not be able to catch the AI making a problem in the first place, and that could repeat itself over and over again. You know?
Yeah, and I liked what you were talking about with the physician, you know, like not using the AI system as a basis necessarily for the treatment that they provide, but more as like an assisting tool.
Yeah, and I think as far as once like the development of AI is like fully complete, which can never really be fully complete, right? There's always going to be some sort of issue, but until we reach a point where we have really good accuracy with data sets and just AI learning and machine learning in general, I feel like there's a point where it almost always has to be a supporting decision maker, right? In
Yeah,
relation to the physician, right? Because
yeah,
we don't.
and
Yeah, sorry. Yeah.
I mean only in the cases where it's like absolutely needed and it's like a life or death situation where if it's a life or death situation and like a physician is not able to like see or use one of their senses to make an accurate like decision themselves, and it's the focus should entirely be on using the AI. That's the only time where we should be relying on AI. Basically, my point here is that as little as little AI reliance as possible, like reliance on that, I think is how we should be essentially using AI in healthcare. And with these issues in AI currently in healthcare, the government has been looking over, at least the European government and their parliament with their committee on legal affairs have been looking over, AI usage in healthcare. And basically what they've done is they've emphasized how there should be the immediate creation of a legislative instrument that governs robots and AI in healthcare, and basically looks over these robots to make sure that they're being kept in check and they're not making inaccurate diagnoses.
Diagnoses.
Ashton, help me. Okay, thank you. Diagnoses,
Or
or
wait.
based on
Yeah.
either
Yeah.
incorrect information or insufficient information, and also make like a system that's capable of anticipating and adapting to any scientific breakthroughs that come with these AI. Just basically having this system that kind of looks over, you know, these AI devices that are currently being used in healthcare. And so, Ashwin, what do you think about this kind of system that Europe has put in place? Do you think it's like sufficient to keeping AI in check? Would you say?
I mean, I feel like AI is always going to have its problems. So especially when we're keeping it in check like this, where it has to be, verified, validated, and everything to keep activities like in check, there's still always going to be problems that we face. And I feel like for every like 100 good cases that an AI might check, one bad decision, I guess, is all AI needs for it to be constantly uh just that's one bad decision is all AI needs for it to be considered, poor or not as good. So the fact that we're
Yeah.
sorry, I'm just gonna continue for a bit here. The fact that we're starting very how to say like no mistakes, have to be perfect. If we're starting like this, I feel like while it has its perks, we need to make sure we're acknowledging the fact that the AI is also reading off of things that are human, and humans can make mistakes. So in that case, AI is bound to make at least some mistakes. There needs to be some sort of second basis or some sort of extra check. So I feel like it's good that we're at least starting with something like this.
Yeah, I definitely agree with what you're saying. The thing is the only like real, I guess, issue that I have with the European Parliament's like, I guess, initiative for like an instrument to govern like these robots and AI in healthcare. It's just that like they didn't really there's not really an instrument out there, and this kind of legislative instrument that they talk about is really vague. And so like how we're going to keep these robots and AI in check like is definitely something of future conversation, because like they don't understand, like again they're oblivious to um differences in humans based on race, economic status, other like different like factors that drive differences within humans. So like even this legislative tool that's like overlooking these AI systems that drive healthcare, like they're also AI, or they're also some kind of like, I guess, they're going to be oblivious to something, basically, is my point. So I guess kind of optimizing that is definitely a point of concern, um, as we look to rely on some kind of legislative instrument in the future.
And that was our 17th episode. So thank you guys so much for listening to the Medicopolis podcast. We hope you all stay tuned for next week's episode and as well as what is to come